And namaskar. Today we're going to talk about this beautiful remedy, Aloe Socotrina. And this time we're going to discuss this single remedy from the explanation given by different authors, especially Dr. N.M. Choudhuri and Dr. Kent. We'll also add a few points which Dr. Allen mentions in his Materia Medica. And we already know Dr. N.M. Choudhary and Dr. Kent have this amazing way of explaining remedies by creating a complete picture in front of us. And today we're going to try to amalgamate both the authors' writings on the same remedy so that we get the whole essence of the remedy and how we get to understand how these authors themselves understood this remedy. So let's start and learn about what these people have to say about the remedy. So we will start with this blockbuster line by Dr. N.M. Chaudhary. But before that, let me tell you that this whole explanation will be first based on what Dr. N.M. Chaudhary says. So the basic structure of the explanation will be whatever Dr. N.M. Chaudhary has written in his own Materia Medica. And we're going to add a few points from Dr. Kent's Materia Medica and Dr. Allen's Materia Medica whenever you find them to be very, very interesting at that point of time for that symptom. We are going to add those as well. So, starting with this line, Dr. N.M. Chaudhary says, to write a Materia Medica without aloe is to write a novel without a hero. So, you understand what kind of importance Dr. N.M. Chaudhary is giving aloe. So, let's see what does this hero of Materia Medica produce, what symptoms it produces. Okay. So, when taken in crude forms, so in the toxicology, it increases the intestinal secretion. Okay, we see that when we are taking it in large quantities in crude forms, what will happen is intestinal secretion will increase. It will increase peristaltic action also. So the intestines peristaltic action. So basically aloe has a lot of action on intestines, on rectum and on anal canal or anus. It has great action on that part of our body or that organ. So it increases peristaltic action, intestinal secretion, produces a sensation of heat, fullness, heaviness, throbbing in rectum. So this is what it does in crude form. But you will see as we go ahead, even in potentized form, it does create this kind of situation. So in the rectum, it will produce fullness and heaviness. Okay, so this kind of also exists. So that is how our doctrine of signature works. So we also see what the crude substance produces. It is what it will cure. So in the that is what keeps on. Obviously, that is what homeopathy is based on, the law of similia. Okay, so in homeopathy, so this was in toxicology. Now, in homeopathy, Dr. N.M. Chaudhary says that aloe justly assumes an important place in the treatment of diarrhea. So, as we have already discussed, aloe has a great action on rectum, on intestines, on anus. So, it is used in the treatment of diarrhea, and it has an important place actually in the treatment of diarrhea. Okay, so let's see. First of all, as you already know, Dr. N.M. Chaudhary always mentions the characteristics of any remedy in the start, and through that we get a very beautiful understanding of the 4 to 5 or maybe 6 to 7, okay, most important points that come under this remedy. Okay, so today under aloe, Dr. N.M. Chaudhary actually mentions 4 characteristics. So these are the 4 most important points that anybody needs to know about aloe. Okay, so while studying about the Materia Medica of aloe, so let's see what are these 4 characteristics that he mentions. So, the first characteristic that he mentions, Dr. N.M. Chaudhary mentions, is that there is a great feeling of weakness or loss of power of sphincter of ani. So, your anus has sphincters, and weakness or loss of power of that leads to a sensation of insecurity in the rectum, and this is the most characteristic thing. This is the first characteristic symptom that Dr. N.M. Chaudhary sees. So to understand this in a better way, let's discuss a little bit about anatomy of the anal canal. Obviously, we're not going to cover the whole anatomy, but we'll study about the relevant stuff. Okay. Now, obviously, it's very good if you go back and study anatomy of rectum and anal canal, because it first of all it will be interesting to study and anat in relation to each other, and secondly you'll also prepare for your anat exam. So over here we see that this first of all is your rectum. Okay, this much is your rectum, and over here is your anal canal. And in your anal canal, you see there are sphincters. So this one is the internal sphincter. Okay, this is, so this is the canal. Okay, this is the whole canal. This is all rectum, and this is all anus, and here are the internal sphincters, and these are the external sphincters. Okay, these are the external sphincters, these are internal sphincters, and both of these actually hold on. Okay, so actually, when you get the urge for stool, we can contain the feces through the external anal sphincter. So this external anal sphincter is actually made up of skeletal muscle, which functions like any other postural muscles that we have in our body. So this one is a voluntary muscle. We can voluntarily, close it or open it, so it maintains the control. Okay, so whenever you need to contain the feces which normally go out, which are, because there is there is this relaxed internal anal sphincter. Whenever these internal anal sphincter is relaxed, and the feces which are propelled through force will come out, but we contain it with the use of these external sphincters by closing them up. So these are important for us to, contain the feces whenever we're not in a position to expel them. But what happens in aloe is there is a great feeling of weakness or loss of power of sphincter of ani. So there is weakness or loss of power of these sphincters. Okay, so this sphincter does not hold that much power now, because of which there is insecurity in the rectum, meaning you're not feeling secure, you're not feeling that you can contain the feces, not because you're not able to contain the feces, and they may be expelled at any time, anywhere. You cannot have the control over it. So that is why it is mentioned over here that there is sensation of insecurity in rectum. So because of this, what happens is that this patient, okay, these people are afraid to pass flatus, fear stool will escape. So these people are afraid to pass flatus because they will fear that stool will also escape along with it, since there is this loss of power of sphincter of ani. Other remedies like this are oleander, phosphorus, china, hyoscyamus, opium, acid phos. So these remedies also have this kind of sensation of insecurity, but obviously it is very, very great in aloe. And I have also added a few rubrics from Kent's repertory, which will be very much related to the symptom that we're talking about. So rectum urging, flatus when passing. Okay. So this is a rubric related to this symptom over here. This rubric is from the Kent's repertory. Okay. Now in Dr. Kent's Materia Medica, he says that this patient, aloe patient, holds the stool with difficulty. Okay, does not dare take his mind off the sphincter, because as soon as he does so, the stool will escape. Since it's voluntary, you need to obviously, keep your mind at it, and you need to pull in your sphincter. You need to have control over it, right? But so this patient knows that his control is gone. There's weakness of the sphincter, so he dare not take his mind off the sphincter. Otherwise, the stool will escape. He cannot let the least quantity of flatus escape, because with it there will be a rush of feces. So he cannot let also a little bit of quantity of flatus escape. Okay, because he's afraid that if I do that, then stool will also escape. The urging for stool is great. He runs for the bathroom, but unfortunately, even before he gets to it, his clothes are all soiled. So since the urging is so great, he cannot control. Obviously, this is going to happen. The rubric relating to it is rectum urging sudden. So that's about the first characteristic symptom we find in aloe, which is the great feeling of weakness and loss of power of sphincter of ani. Let's go to the second characteristic symptom. So the second one is about the great feeling of fullness and weight in the pelvis. So this feeling of fullness and weight in the pelvis, as if the rectum were full of fecal matter. So they feel as if the rectum were full of fecal matter, which would fall out if not for the extreme caution. So they have to be very cautious, otherwise their sphincter might open up and the fecal matter might fall. That is what they feel, as if the rectum is full of fecal matter, even if it is not full of fecal matter at that point of time. They have this great feeling of fullness and weight in the pelvis. Now the rubrics relating to it in the Kent's repertoire are abdomen heaviness as from a load. So the whole pelvis they're talking about, right? The pelvis is completely full and heavy. So abdomen heaviness as from a load. Rectum fullness. Rectum dragging, heaviness, weight. Okay. The third point is about the loud rumbling and gurgling in abdomen. So there's this good we say, right, in Hindi. So there's this loud rumbling and gurgling in abdomen in aloe, and that is as though water were running out of a bottle. So if you just take the cap out of a bottle and you run out the water through it, so the exact noise that it creates is how aloe creates, okay, in the abdomen of these patients. So this symptom when present in dysentery becomes a great, this is what Dr. N.M. Chaudhary tells us, that this symptoms, he gives us a tip. If you find this symptom in your dysentery patient, then that becomes a great characteristic. It will actually lead you to this remedy then. So that's what. Okay, so there's loud rumbling and gurgling. Now, Dr. Kent explains it even more beautifully. He says that it seems as if the abdomen would burst, and the rumbling is so great that it can be heard by anyone in the room. So now you understand how loud the noise is. And obviously, the noise is like water were running out of a bottle. So it is so loud that anybody in the room can hear it, and it is as if the abdomen would burst, and the rumbling is so great that it can be heard by anyone. Okay. So that's about it. So until now, we learned about three important characteristics. The first one being great feeling of weakness or loss of power in the sphincter of ani, which will lead to the sensation of insecurity in the rectum. The second one being the great feeling of fullness and weight in the pelvis. And the third being the loud rumbling and gurgling in the abdomen. Alright, now the fourth one is the aggravation of the condition after each meal. So whenever they eat, this condition gets aggravated. And the same thing after aggravation after meal is found in arsenic, china, lyco, podo, trombidium, crotontic, and ferrum. These are also our medicines. Podo means podophyllum, lycopodium, okay, crotontic, ferrum, and trombi. So these are the remedies which also get aggravated after meal. That is what Dr. N.M. Chaudhary says us. Now, Dr. Kent again comes in here to tell us that every mouthful of food, so he actually explains it in more detail. So he says that every mouthful of food, okay, hurries him to stool. So hurries this patient to stool. Drinking water will often hurry him to stool, give him colicky pain in bowels, even in constipation. So see the aggravation from food. Even if he is having a mouthful of food, it will hurry him to stool. And not only food, but even if he drinks water, that will also hurry him to stool. So see, not just food but water also. Now give him colicky pain in bowels even. So in constipation, so normally what we see is when you have diarrhea, you have a lot of rumbling, gurgling, pain in abdomen related to the diarrhea. But now they're saying that even in constipation, these patients have this kind of colicky pain in the bowels, which is especially seen after eating. So constipation patient after eating telling you that I have pain in my stomach just after eating or abdomen just after eating. So that can also be a symptom relating to this. Okay, so some rubrics that Dr. Ken mentions are generalities, eating after aggravates. So even generalities, so meaning the whole condition. Okay, so the whole thing, okay, not only his rectum or not only his abdomen related symptoms are getting aggravated, but in general the patient is getting aggravated after eating. Rectum urging eating after, so obviously they want to go to stool, that is what hurries him to stool. So rectum urging is there after eating, and rectum diarrhea eating after, which again means the same. Since now we're talking on the topic of food, let's also discuss the ailments for the diarrhea of aloe. This is what Dr. Kent mentions. Okay, he says that diarrhea is in these patients is from eating oysters out of season. Okay, or in hot season. So we all know that Lyco has poisoning from oysters, right? The Lyco is very famous for actually having this oyster aggravation. So whenever they eat oyster, they have some kind of complaint after that. That we know about Lycopodium. But over here, Dr. Kent says that there's diarrhea from eating oysters out of season or in hot season in aloe. So that is how we differentiate. So Lyco has poisoning from oysters when they eat it in the season, but aloe has it when they eat out of the season. Okay. So see how minutely they have differentiated and observed first of all. So when you have oysters out of the season, aloe comes to your rescue. That is in hot season, aloe comes to your rescue. But when you eat it in the season, Lyco comes to your rescue. Secondly, there is also diarrhea brought on from drinking beer. Okay. Now, Dr. Kent says that in persons who have diarrhea, every time they drink beer, you will most likely find that aloe will agree with the symptoms. But sometimes it will also be Kali Bai. So, Kali Bichromicum also has diarrhea from drinking beer. Okay. So, sometimes you need Kali Bai, sometimes you need aloe when patient comes to you after that he has diarrhea after drinking beer, because these two remedies are very similar as to their stomach and bowel symptoms. So he mentions that Kali bichromicum and aloe both are very similar in the stomach and intestine related symptoms, and that is how you'll also find them coming to you after drinking beer. So both of them have this ailments from. So that is how we we learn about the ailments from of diarrhea of aloe. Now let's talk about the character of aloe stools, which are very, very striking. So in dysentery and in diarrhea, it is given differently. So in both Dr. N.M. Choudhuri and Dr. Kent give it differently. Okay, so in dysentery we find that there is transparent jelly-like stools. Both of them say the same. Okay, and in diarrhea we find this yellow semi-liquid fecal stools in aloe. Okay, so when you have transparent jelly-like, it's mostly seen in dysentery actually, and in diarrhea it's yellow and semi-liquid. Now, Dr. Kent says that they are gushing and of thin, yellow, offensive, excoriating feces which burn like fire. So this is what he adds actually. He says that these stools burn like fire and the anus becomes sore because of that. Okay, so obviously there is thin yellow feces just like Dr. N.M. Choudhuri says, but they burn like fire. And now, Dr. N.M. Choudhuri further mentions that the diarrhea of these patients, okay, aloe, is always worse while walking or standing. So, if they're walking, if they're standing, they'll have aloe stools coming out involuntarily. Okay, they have more symptoms related to diarrhea. Now, during diarrhea, they're hungry. This is what Dr. Allen mentions. Okay, so Dr. Allen tells us that during diarrhea, they become hungry. And after diarrhea, after stools, all the pain cease, leaving profuse sweating and extreme weakness. So just after all the diarrhea goes, you just go after stools, you have all the pains that were there in your abdomen, your rectum, whatever, they will cease. And after that, you will just be, sweating profusely, and you'll have extreme weakness, great prostration. You might also faint. That is what Dr. N.M. Choudhuri says. So this is what Dr. N.M. Choudhuri says, and this blue colored is all what Dr. Allen says, and this pink or crimson color is whatever Dr. Kent says. Okay. So all pains is leaving profuse sweating and extreme weakness. So now you know the diarrhea of aloe. In the diarrhea of aloe, what you need to say is, first of all, you need to mention the 4 characteristic points that we've already discussed. Okay, you need to mention those. You need to see those in your patients. And the stools, the color will be yellow, semi-liquid. They will be semi-liquid, and you will see that they're offensive also, and they burn like fire. The diarrhea modalities related to it are that it is aggravated when they're walking or when they're standing. During diarrhea, the concomitant is that they are hungry, and after stools, they will be sweating, and they will be very, very weak. They might also faint. Okay. Moving on to the next point now, which is about congestion. So the next point that we're going to talk about is about congestion. Now, what does congestion mean over here? So let's understand it very easily in very simple terms. So what is normally congestion? You said that the road is congested. You say normally, right? That the road is congested. Meaning what? That the road is containing of more vehicles than it should. Okay, it is containing of so many vehicles that you're not able to go forward, right? So in the same way, when your veins contain a lot of blood than it should, okay, more amount of blood than it should normally do, and that blood is staying over one area in the vein, just it is not moving forward. Okay, it is into stasis, then that is called as engorgement of veins. So basically your veins are congested with a lot of blood. That is what congestion means over here. Now we will see that this congestion of veins, of blood vessels, obviously since the veins are present all over your body, the effects of engorgement of vein will also be seen all over the body. But there are a few important organs on which it is mainly seen very characteristically, and especially in aloe. So those over here are you see the portal system, meaning the liver, the portal vein that is there. Okay, that portal vein along the liver and all, and to the head, and obviously bleeding all over the body because veins are everywhere. So there will be venous oozing from the nose, from the bowels, from the bladder, and bleeding in general. This will be there because the veins all over the body are full and are engorged, and this will lead to this venous oozing because they're so full that they cannot accommodate any more, and that will lead to venous oozing. And this will result in bleeding, obviously. Now we'll see what it does to the head and to the portal system. Now this point is actually added by Dr. Kent. As I told you, whatever is written in crimson is by Dr. Kent. So, but Dr. N.M. Choudhuri mentions this much only, that congestion. So he actually very beautifully tells us. He takes this point as a single common thing, and he explains to us the action of aloe on these both spheres using the same point, because it is how the physiological or the pathophysiological connection is there. So understanding it this way makes our learning of this remedy very much simpler than just remembering and trying to memorize that this remedy has action on head, this remedy has action on liver or on the portal system. So that is difficult to remember in that way, but it is very easy when we know that a single common thread exists between this condition in the head and in the liver or around the portal veins. So, what happens is when the veins in the head or the blood vessels in the head get engorged, get congested, there is headache in these patients. Okay, this headache, they have dull frontal headache, they have heaviness in eyes along with the headache. Okay, there's dull frontal headache plus heaviness in eyes, and this headache alternates with lumbago. What is lumbago? Lumbago means backache. So there's headache first of all, and then as the headache ceases, you have backache. Again, after backache ceases, you have headache. So in that way, headache and backache just alternate with each other. So headache alternates with lumbago. And Dr. Actually Kent adds this point, which is aggravation from heat and amelioration cold application is seen in the head also. And we see in Dr. Kent's repertory also that there is head pain, cold applications ameliorate. This is a rubric, 3-mark rubric. So it is very important. So cold applications ameliorate the headache. But now what Dr. Kent says is that this aggravation from heat and amelioration from cold application is not something that is just related to the head. Okay, that is just confined to the head related symptoms of aloe, but this is something that just runs through the complete remedy. So it is through and through the complete remedy. And how do we know that? Because this patient of ours, aloe, wants cold room. Okay, because he's ameliorated by cold application. He's ameliorated by everything that's cold. So he wants to be in a cold room. Okay, he feels hot and flushed. The skin is often hot and dry. He wants to be uncovered at night in bed. So he does not want to be warmed. Okay, he does not want a warm atmosphere. He likes cold rooms. He does not want to cover at night. He lies uncovered in the bed. He has burning of the extremities. Okay, like we see in sulfur also, we see that there's burning in the soles of sulfur. So there's burning in the extremities in aloe also. The hot hands are there. The feet are cold. Again, like sulfur, the feet are cold. And there's cold hands, hot feet also. Both can exist. Okay, they may have hot hands and cold feet, or cold hands and hot feet, and these might also alternate. And the head also feels hot, and so he wants something cool upon it. So that is how the head is also there. Okay, related to that. There is from the heat of surface, not so this sensation of heat in the surface, and this feeling of congestion and fullness of the surface of the body. So as we've already discussed, that this feeling of this fullness is a characteristic symptom of aloe. Now whatever Dr. N.M. Choudhary mentions as a characteristic symptom, it is actually applied in every sphere of action of that remedy. So over here we're talking about head or any part actually, the same thing will apply. So that is what we've discussed, that there's feeling of fullness and feeling of heaviness. So that will also be there. Along with that, there will be that sensation of heat which we're talking about now. So this is something that runs through the remedy and is not only confined to the head of this remedy. Okay, now going to the portal system, which actually contains an important thing of rectum, important sphere of action of rectum. Now, in the portal system, you have this portal vein which gets completely congested, and this portal vein is something that also supplies your rectum. So when not your portal vein, but the branches of your portal vein finally supply the rectum. So the rectum gets full. So the veins around the rectum, which are, I'll show you. So these, when we were talking about this diagram, so these are the veins that you find in rectum. Okay, these are the veins that you find in rectum. So this is actually your tubular structure. So rectum is obviously a tubular structure like all the intestines. But what we have done is we have cut through this and we are seeing what lies inside of it. So these are the veins that will be there. Okay, and what happens is when so normally these veins will look like somewhat like this. Okay, normally it will look like somewhat like this. This is also a diagram of anal canal only. So these will look like this. But now what happens in hemorrhoids is these, because there is a lot of blood in these veins, that such amount of blood that they cannot even have it. Okay, they do not have the capability. So what will happen, because of the weight, because of the gravity, they will just fall down. The veins will be full of that venous blood and they'll fall down, and even here also you'll see that they are just falling down in this way. So this is called as prolapsed internal hemorrhoid. So now this is internal hemorrhoid, okay, and it is prolapsed, and this is external hemorrhoid, and it is prolapsed. So the veins over here are getting full and they're getting prolapsed, and the veins over here are getting full and they're getting prolapsed. So that these will form internal hemorrhoids, and these will form external hemorrhoids. Now you might also know that the internal hemorrhoid is not painful, but the external hemorrhoid is so. Now why is this? Okay, why should this be like that? So the internal hemorrhoids are actually come into the upper part of rectum, and the external obviously come in the lower part of rectum. The upper part of rectum, which is 15 mm, is actually supplied by the autonomic nervous system, but the lower part of the rectum, which is 23 mm in size, it is in height or size, it is supplied by the pudendal nerve. And since it is supplied by that nerve, it is painful. So this external hemorrhoid is always painful, but internal hemorrhoid is not painful. So this is about the hemorrhoids of this remedy. Okay, so what happens over here is, in rectum, since there is this congestion, there is this whole fullness of veins, there will be hemorrhoids. And so now you know what are hemorrhoids. Hemorrhoids are nothing but these veins full of blood, engorged with blood. They will protrude like a bunch of grapes. So these will protrude out like a bunch of grapes. Okay, just like a bunch of grapes, and piles are moist due to constant mucus secretion from the anus. What happens is, from the anus you find that there is constant mucus secretion, and this is also something that Dr. Ken mentions, and we'll talk about it as the last point of our lecture. So there's constant mucus secretion in this remedy. Now over here it is taking place from the anus, and because it is there, it will obviously go on to the piles which protrude like a bunch of grapes, and that is why these piles are always moist. Okay, and these piles are very sore, tender, hot, and itchy. This is a very important point. Piles in aloe are very itchy. There's constant backache along with these. See, you also saw that headache alternates with lumbago in this remedy. Okay, headache alternates with lumbago, and now we're seeing that there's also constant backache with hemorrhoids. So backache also forms a very important part of this remedy. Okay, backache accompanies many complaints of this remedy. So there's constant backache, bearing down in rectum, and there's itching and burning in rectum, which prevents sleep. So you see that this itching and burning is so much that Dr. Kent mentions over here that this patient is compelled to bore with a finger into the anus. So violent is the itching that the patient cannot let it alone. It seems it will drive him to distraction. So the itching is so much that they need to bore their finger into the anus for itching the parts. So that is how great the itching is in anus, and we've already seen that this burning in anus also, that now this burning is there in rectum also. So rectum is also itching is there, so they need to just put in their finger and itch it. So this is how it all is. Okay, now in abdomen also, since there's liver in abdomen, and obviously if the portal system is affected, your liver, it's related. So abdomen has this constant fullness and heaviness. It is again something that we saw as a characteristic symptom. So as we've discussed already, that anything which Dr. Namsori mentions as a characteristic applies to almost every part of the body of that remedy. So this constant fullness and heaviness in abdomen in this remedy. So this whole chart actually helps us understand the action of this remedy on different parts, and the symptoms which this remedy produces are all because of engorgement of veins or congestion. So the central thing in aloe that you need to remember is engorgement veins or congestion, and if you do remember this, you can obviously logically also tell about all the other points. Okay, so so that's it. No, there's one more point that needs to be discussed, that there's this comparison that Dr. N.M. Choudhuri gives us over here. He says that aloe piles are such and such. Now he tells us that tells us about the bromium piles. Okay, bromium is a remedy, and that remedy also has kind of piles. And in bromium, there's amelioration by application of saliva. So if they apply saliva to their piles, which is a little weird when we hear it for the first time, but that ameliorates bromium spiles. Okay, that will reduce their suffering. So if you have this kind of symptom in your patient, you can obviously try giving bromium. It will help. And if you have muriatic acid, the piles that muriatic acid has, you'll see that the modality over here is that they feel better by application of warm water. Okay, and just now we discussed about a remedy. We're discussing about a remedy that is aloe, which is ameliorated by cold application. Just like it is in the headache, it is obviously going to be the same in hemorrhoids. So when they'll apply cold application and they apply cold water, they'll feel better. But the opposite, that is the application of warm water, will ameliorate piles of muriatic acid, and bromium piles ameliorated by application of saliva. Okay, so that's about the congestion related symptoms. Let's move ahead and discuss about a case of constipation as Dr. N.M. Choudhuri mentions in his Materia Medica. Okay, Dr. N.M. Choudhuri. So this is an interesting case. What happens over here is that there is a 5-year male, which is obviously a little boy, and that little boy is brought to doctor. This is what Dr. N.M. Choudhuri says. Okay, this little boy is brought to our clinic at college years ago when I was a student in the Herring Medical College of Chicago. This is what Dr. N.M. Choudhuri is saying. So when he was studying in the Herring Medical College of Chicago, that time a boy was brought to the clinic in the college. So what were the symptoms that this boy had? This boy used to soil his clothes at all odd times with hard lumpy stools. Okay, so in diarrhea, normally what you see, the stools are loose, and we've seen that the stools of aloe in diarrhea are yellow, semi-liquid. But this patient is having this hard lumpy stools, which means he is having constipation. Okay, but still he is soiling his clothes at all odd times. So at all odd times, he is just passing these stools, which his mother ascribed to sheer wickedness on his part. So now what his mother is saying, that he is doing it, just because he wants to trouble me or like that. Okay, he's doing that intentionally. But you as a doctor, or whoever doctor was attending, obviously they knew that this is happening because there's involuntary escape of stool. Because there is involuntary escape of stool. And why is that? Because there is insecurity, right? There is insecurity of the sphincter of ani in aloe, or in this patient, and hence you give him aloe, right? A few doses of aloe put an end to all his unintentional villainy. So since he is not able to contain the stools, that is why the stools are getting out. Okay, it's not because he is intentionally doing it. So now this case you should remember, because even if it's a case of constipation, it's a case of constipation, and yet normally what happens in constipation is you have to strain and strain and strain for the stools, right? But in aloe, it's not so. Even in constipation, when they are having hard lumpy stools, they will have involuntary escape of stools. What is the reason? The reason is obviously there's insecurity of sphincter of ani, but there's another important reason which is related to the anatomy of rectum. So when we study the anatomy of rectum, we find that there are these Houston's valves. Okay, so there's one Houston valve here, second over here, and third over here. Okay, so there's 3 Houston valves that we have in our rectum. Now what we study in anatomy is that when you have a failure or damage to your second Houston valve, especially to second, but to all of them, but especially to second Houston valve, then that will lead to fecal incontinence, meaning you're not able to contain the feces. Now this may be or may not be the reason of fecal incontinence in aloe, but obviously we need to think about it in those lines also. It might be the reason because that's what our anatomy tells us. Okay, so when second Houston's valve is not working properly, it's damaged, then that will lead to fecal incontinence, and even all 3 actually, but especially the second one. Okay, so that is happening over here, and because of that, this patient, even if he has constipation, he is not able to contain the stools. They're coming out just like that. Over here, I'll also like to mention an interesting point. We all know about fissures in anus, right? Fissure. What is a fissure in anus? You have a crack. That is what you say, like in a layman terms. That is, you have crack in your anus because you have hard stools, and that will lead to a lot of pain. Now, what is happening actually is, you have this anal valve. See, this is the anal valve that you have. Okay, these are the anal valves. What happens whenever this anal valve ruptures due to passage of any hard stools, then that will lead to fissure in ano. Okay, so now you know exactly where does the crack appear. So it is in the anal valve. Okay, all right. So let's come back to aloe. So now talking about the mind of this remedy. In the mind of aloe, we find authors have written quite a few symptoms about this remedy. They say that there's Dr. Anamsari says there's a great depression, lassitude, and languor clouding the mental atmosphere. Here, Dr. Allen also says that they are averse to mental or physical labor. They are indolent, meaning they are lazy. So these people are lazy. They do not want to move. They are lazy, and not only lazy physically but also mentally, because they are averse to any kind of mental or physical labor. So they do not want even mental or physical labor. They're indolent, and we see that also in a rubric which is mind, work, aversion to mental. Okay, they are fleshy and phlegmatic. They are highly dissatisfied and angry about themselves or his. This is Dr. Anamsari mentions that they are angry about themselves only, but Dr. Allen adds that they are also angry about their own complaints. So whatever disease they're having, whatever suffering that they're going through, they're angry about that. They're angry about themselves, dissatisfied about themselves and their complaints. They are first of all indolent. They do not like any kind of mental or physical labor. Okay, and they decide for angry. Now they consider life as almost a burden. So life has become a burden for them, and they carry on their existence in a sad, dispirited sort of way. Over here, Dr. Kent adds that this aloe patient is extremely excitable. Okay, this patient is extremely excitable, and when under the extremely excitable when under the influence of pain. So when they are going through pain, they are extremely excitable, and the pains are generally in the abdomen, because we know that this remedy is mainly for diarrhea and congestion, but mainly from diarrhea also. So colic-like pains, flatulent pains in the abdomen that drive him to despair. So again, that will make him sad. So the sad. Okay, everything is sad. So that will again make him sad. He will become extremely irritable and excited in his attacks of colic. Whenever he has pain, he will get excited, and because of that he will be irritable. A little symptom that is somewhat striking is he hates people and repels everyone. So he's so sad, not only about himself, not only dissatisfied and angry about himself, on himself, but he will hate everybody and he will repel everybody. Okay, he hates everybody and repels everybody. That's about the mind of this remedy. Going on to the last point that Dr. Kent mentions, which is about the thick jelly-like mucus. So Dr. Kent adds a point in which he says that whenever a mucous membrane is inflamed, okay, in aloe, then there is a deposition of thick jelly-like mucus. Now there are examples that he gives. He says that if there is an ulcerated spot, or maybe an after sulfur ulcer, or maybe an inflamed surface anywhere in the body, then there will be thick jelly-like cakes of mucus. Okay, there will be thick jelly-like cakes of mucus, which may be peeled off almost as thick as leather at times. So much of mucus gets accumulated at that point, wherever there is this kind of pathology, that the jelly becomes as thick as a leather, and at times the lower part of rectum is in this state. So at times this also. So I had told you that we are going to talk about this point at the last. Okay, this point that Dr. Ken mentions. Now we're talking about that same point. So at times the lower part of rectum is in this state, and the patient will say that the lumpy stools are caked in jelly. That is why the piles were moist, because the lower part of rectum was in this state. It was producing this huge, leather-like thick cakes of mucus. Now sometimes the aloe patient, before having a stool, so before even they pass stool, they will expel a teacup full. Imagine a teacup full of thick jelly-like mucus. So that much jelly-like mucus will first come out before the stools. That may also happen in this remedy. So this is a very important point about the thick jelly-like mucus that Dr. Kent adds. Next, he mentions a very interesting case which is based on this very symptom that we just discussed. Okay, so this is a case of stricture of the rectum. This stricture which prevented nearly all the fecal matter from getting down to the anus. So what happens in stricture is that the canal narrows away. So somewhere in the canal there is this narrowing of the canal, because of which the contents are not able to pass through. So the stricture prevented nearly all the fecal matter from getting down to the anus, but the rectum would fill up 3 to 4 times a day and compel the patient to expel a quantity of jelly-like mucus. So what is happening is, since there is a stricture, the fecal matter is not able to pass through it, but the jelly-like mucus is able to pass through it. So this jelly-like mucus passes through it, and the patient is, just expelling 3 to 4, this so much of jelly-like mucus. Now, the feces that could be forced through were scarcely larger than a pipe stem. So, even if the feces are coming out, they are just like a pipe. Okay, they are very small and they're like pipe. It has been said that our medicines are now this is what Dr. Kent says. Okay, it is very important. He says that it has been said that our medicines are not capable of curing strictures, but sometimes they do cure strictures if they can cure the patient. That is what we say. Okay, symptoms are not something that we're curing, disease is not something that we're curing the patient as a whole. And that is how, when we cure the patient as a whole, when we stimulate its vital force, then the body will cure its own. Okay, then the body will get cured on its own, the body will cure itself, in fact, so heal itself. So if you can cure the patient, then it is marvelous how nature will take up all that inflammatory tissue and the canal becomes normal. So whatever inflammatory tissue was over here, which led to the narrowing of the canal, our body will eventually, because the vital force was stimulated, because we cured the patient as a whole, the body will heal this part, take up all the inflammatory tissue which was over here, and bring the anal canal back to normal. This thing has been seen many times in stricture of urethra and in the stricture of rectum. So this is a beautiful point that Dr. Ken mentions, which tells us about the importance of curing the patient as a whole, not looking at the patient as if some object which has a disease, but the patient needs to be looked at as an individual, okay, as a whole person, as a human. Next, we talk about the last point. Here we discuss about the relations that Dr. Allen and Dr. Ken mentioned. So Dr. Allen says that, like sulfur in many chronic diseases with abdominal plethora and congestion of portal circulation. So this remedy is like sulfur in many chronic diseases, in abdominal plethora and congestion. So we have seen sulfur, we have talked about sulfur. Sulfur also has its congestion in the circulation, especially portal circulation, and we already talked just now about aloe, and it also has congestion. Dr. Ken mentions that aloe, Kali bichromicum and sulfur are wonderfully related to each other. Again, okay, sulfur, Kali bi and aloe are wonderfully related to each other when it comes to their action on stomach and bowels. Okay. So that's all about the remedy. Let's just revise it very quickly. So we started talking about the characteristic symptoms that this remedy has, which were mentioned by obviously Dr. N.M. Choudhuri. He does that in all remedies. So the first point was about the weakness or the loss of power of our anal sphincter. That led to the sensation of insecurity in rectum, right? And the second point was about the feeling of fullness and weight or heaviness in pelvis and in abdomen and etc. Okay, then the third point was about the rumbling and gurgling, which was very loud. Anybody in the room could hear it, and it was as if a bottle running out of bottle. Okay, the fourth point, which was the last point, was about the aggravation that these patients have after each meal. So they are not only aggravated in the diarrhea symptoms, but in general also. Every mouthful of food will hurry them to stool. And when we're talking about food over here, since we're talking about food, we also talked about the ailments for diarrhea, which were given by Dr. Kent, which was first from oysters. And very important thing is that it was out of season. So oysters, aggravation out of season, when eaten out of season. And second was from beer, like our remedy Kali Bai. Okay, that was what we talked after it. Then we went on to talk about the character of stools or the diarrhea or dysentery of aloe. So in dysentery, we saw that these patients have transparent and jelly-like stools, but in jelly-like stools, and in diarrhea we saw that these have yellow colored stools, which are semi-liquid or semi-liquid or semi-solid. And then they have this, all these are offensive also, and these are, these burn like fire. And the aloe, the anus also becomes sore because of that. Then we saw that this diarrhea used to get aggravated while walking or when the patient was standing. Also, during the diarrhea, the patients are hungry, so this was something that happens during the diarrhea. After it, the patient will faint, will become very, very prostrated, and might also start sweating profusely. Okay. That was about the four important characteristic points and about the characteristic rules about the diarrhea of this remedy. Then we went on to talk about a very, very important point related to aloe, which was the congestion that we see. Let's just go through the map once, or the chart once. So what happened in congestion? There was engorgement of veins which affected portal stump, head, and bleeding all over the body. Since venous oozing was there, headache also was there, which was alternating with lumbago, which was aggravated by heat and melted by cold application. We also saw how this runs through the whole remedy aloe. In rectum, we see hemorrhoids. In abdomen, also constant fullness and heaviness. In rectum, we see hemorrhoids which protrude like a bunch of grapes. Piles are moist due to constant mucus secretion. No, there's itching and burning. And we also studied about some other remedies and how they are compared with it. We first of all, we also studied about the diagrams. If you remember the whole points relating to the symptoms when you see the diagrams, these were seen. And we also had the hemorrhoid related diagram. Okay, then this was about congestion. Then we went on to talk about the mind of this remedy. We first actually discussed a case of constipation. Then we went on to talk about the mind of this remedy, in which we saw that these people do not like mental or physical exertion. They want to be, just lazy. They want to be lying down all day. So they are not very good at any kind of work because they do not want to do it. They are lazy. They do not want to do it. Okay, then we saw that they're very angry and dissatisfied about themselves and also about the complaints, whatever complaints they have. Okay, then we saw that they see life as a burden. They are, they are always sad. They are dispirited, and this sadness also is goes to a level that they hate people, repel everyone. They get extremely excitable when they are in pain. They will get irritated and sad when they are in pain. Okay, then we talked about the another important point which Dr. Kent gave us, which was about the jelly like mucus which keeps coming out of the various different parts, whichever part has a pathology, ulcerated spot or inflamed surface or even stricture of anus, whatever. Okay, it keeps on oozing this jelly like mucus which may be as thick as a leather. And we finally saw the relations, in which we saw that it relates to sulfur and kali bichromicum. Okay, so this was the whole quick revision, very quick actually, revision of aloe that we have discussed today. I hope you liked it and you go back and read it from even more authors, Materia Medica authors as Materia Medica, and you also go through Kent and N.M. Choudhuri ones.